Well, good morning, everybody. Thank you, Michael. Welcome to the White House. Thank you for taking the time to join us at this important meeting. And I particularly want to thank people who have traveled overseas to be here with us today. It's wonderful to have you here. I'd also like to thank Tina and Michael for their support of this effort, and Michael and his office for his great work. And this year, 3 White House offices are participating in this meeting. And this year, it's an honor to co-sponsor the meeting with Michael's office, the Office of National Drug Control Policy. In addition, I'd like to thank Ambassador Gooseby from State, the Office of the Global AIDS Coordinator, for joining us. He will be joining us shortly. And of course, Drs. Howard Koh, Ron Baldessari, and Niels Dallaire from Health and Human Services. And you'll also be hearing from each of them later in the program. Now, as some of you know, the Office of National AIDS Policy began convening this meeting at the White House 4 years ago. And since then, a lot has happened. When we first began these meetings, a presidential proclamation had never been issued for viral hepatitis. Now President Obama releases a proclamation each year, and Michael will be reading this year's. When we first began these meetings, we did not have rapid tests for hepatitis C, nor a positive recommendation for hepatitis C screening from the U.S. Preventive Services Task Force. Now we have both. When we first began these meetings, oral-based medicines with high cure rates and shorter treatment periods for hepatitis C were a thing of the future. Now they are a reality. These meaningful advances are making real differences in people's lives. Now, some people may ask why the Office of National AIDS Policy initiated and continues to host this meeting. What does viral hepatitis have to do with HIV? Well, there are many factors that these conditions share. Indeed, the similarities are striking. Both HIV and hepatitis disproportionately affect specific populations in our country, including people of color, gay and bisexual men, and substance users. We are dealing with overlapping epidemics in most of these communities. And to be most effective in fighting both epidemics, we cannot afford to remain isolated in disease-specific silos. Another common factor is undiagnosed infection. Many individuals living with HIV and viral hepatitis do not know they are infected. We need to increase testing rates for both. And stigma remains a major issue for both conditions. Stigma keeps people living with HIV, viral hepatitis, or both from getting tested and receiving appropriate care and treatment. Addressing stigma is critical for us to succeed. I've mentioned the shared challenges for addressing viral hepatitis and HIV, but there are also some very positive elements and successes that both conditions have in common. We have rapid tests to screen for both and effective treatment options that seem to improve each year. Under this administration, we have developed the first comprehensive national plans to address viral hepatitis and HIV, and we have bipartisan congressional caucuses devoted to addressing both epidemics. We share many of the same smart and committed researchers, scientists, program staff, and leadership who are devoted to addressing both epidemics. And perhaps most importantly, the fight against both epidemics brings together talented and tireless advocates who ensure that viral hepatitis and HIV remain at the fore of our national efforts to address health and wellness in communities across the United States. So I want to thank you again for joining us for this important meeting, and I look forward to a very successful event. Thank you.